Now, let's have a quick review on what we have learned about DeQi in the subject of techniques of acupuncture and moxibustion. It's generally believed that DeQi has a term of arrival of qi in ancient times and a term of needling sensation now. After the needle is inserted into a certain depth of an acupoint, needling manipulations such as lifting, thrusting, or rotating are exerted to the needles so that meridian qi reaction can be obtained in the needled area, and this is termed DeQi. Whether DeQi is obtained or not can be judged from two aspects. One is the feeling and reaction of the patient to acupuncture. That is, the patient feels soreness, distension, heaviness, and numbness in the needled area, and sometimes the hot, cold, painful, twitching, and ant-crawling feeling, or transmitting and radiating feeling towards certain directions or areas. The other is that when DeQi is obtained, the practitioner will have the sinking, tight, and unsmooth feeling when operating the needle or feel the reaction of the needle body such as quivering. If DeQi is not induced after needling, the patient won't have special feeling or reaction, while the practitioner will have the empty, loose, weak, and smooth feeling when operating the needle. Almost all modern textbooks will state that effect is achieved on the arrival of qi, so it's very important, as it's closely related to the therapeutic effect. In modern textbooks, it's usually said that DeQi is the key of therapeutic effect of acupuncture. In application, DeQi is regarded as the foundation of acupuncture treatment. It's necessary for you to have DeQi, and after DeQi, you need to do some reinforcing and reducing techniques. Whether DeQi is obtained or not can be used to judge the condition of the vital qi or meridian qi, and in some books, it's also said DeQi can be used to judge the vital qi or evil qi. Besides, DeQi can also be used to judge how quick acupuncture will take effect. Bearing the modern definition and recognition of DeQi into mind, we may notice quite a few clinic practices which don't accord with them. For example, question number 1. In acupuncture clinic, some doctors won't care whether the patient has any feeling. Do they judge DeQi by their feeling beneath the needle? Question number 2. If doctors can judge DeQi according to their feeling, is it important for doctors to ask the patient about their feeling during the treatment? Question number 3. There are quite some acupuncture techniques. When will they be performed, before or after DeQi? Question number 4. Is DeQi necessary for acupuncture taking effect? Question number 5. Some patients don't have DeQi because they don't like the feeling and ask the doctor not to perform any techniques except for insertion and withdrawal, or because before they can have any feeling, doctors stop manipulating needles. Will acupuncture work for them? If you have any clinical experience, I'm sure you can have answers which are absolutely inconsistent with the textbook, which means even if the patient don't have feeling and doctor doesn't perform any techniques except for insertion and withdrawal, and they don't have DeQi feeling either, acupuncture can still work in some cases. So how can this be? Are there something wrong with modern textbooks or classic acupuncture theories? Let's take a look at what DeQi was in ancient literatures before answering the questions.